Hi everybody, Dr. Daniel. Today I'm talking about how long does a migraine last? Well, most people in the world are not familiar with the International Classification of Headache Disorders. That's published and used by headache doctors and institutions. It's taught to neurologists in training, certainly headache doctors. It's all over the internet. And it is said to be the Bible, or it's the reference for headache disorders for doctors for the world. So for many people, it's difficult to tell a headache that comes on. It's tension headache, a brain tumor, an aneurysm, or just migraine. They don't know. They don't understand the specifics. But the International Classification of Headache is clear about how long a single migraine can last. And that clear definition is it could last 4 to 72 hours, which is 3 days. And the problem is some persons overtreat with medications and they get what's called chronic migraine. And about 80 to 90% of persons who have chronic migraine, they're getting out from medication of headache from overtreatment of headache medicines, such as over-the-counter drugs like Tylenol, Advil, caffeine, naproxen, or using butalbital or opiate narcotics, or even triptans. You can get medication overuse headache. So the patients confuse a single episode of headache, like a migraine 4 to 72 hours, with this chronic deal. A chronic migraine is defined as 15 headaches a month, 8 of which have migraine features. And the migraine features are, it's a severe headache, a level of 1 to 10. The headaches are 8, 9, 10, or many patients would tell me they're 30 or 100 or something like that, making a joke in the office when we're talking. It's a one-sided headache 80% of the time. Headache is throbbing because the chemicals that come out during a migraine inflame the arteries, and the arteries are stretched and vasodilated. Let me show you. Stretched and vasodilated by the pulse, and so you get pain with the stretching of the artery. You get a throbbing headache. If you were to graph it, it would go up and down like that, up and down. Yeah. So people who have medication with headache, they may have headaches lasting a week or a month. I've seen patients who've had it lasting 50 years or 60 years or so from overtreating. It's been going on all their life. Or some patients will come in and out of it. They'll have it like a week or two or maybe a month, and then it goes away. So if a person has a bout of this type of headache when they're really disabled and down and can't go to school, can't work, can't get out of bed, can't open their eyes, can't have their clock near them ticking because it bothers them so much with headaches, so they're so sensitive to sound, they may wonder, what is this? How long does a migraine last? What's going on? What have I got? So I'm going to talk about that. So if you use the time frame of a headache that lasts 4 to 72 hours, you're going to pretty much capture migraine within that net of diagnosis of just time course. That's one way to diagnose migraine, is the time course. The other way is to look at the symptoms, as I mentioned before, which we'll call just migraine symptoms. So by definition, the International Classification of Headache Disorder says a single attack of migraine may last 4 to 72 hours. And that's a reference of time delimiting an episode of headache, which is helpful in telling migraine from other kind of headaches. Tension headache usually comes at times of stress and tension, not always, but it many times will come then. And it lasts hours and goes away unless it's chronic tension headache, which it could be. This migraine process causes the release of the 3 neuroinflammatory neurochemicals, and they, the worst one there is probably CGRP, which is found in peripheral and central neurons. And CGRP causes active vasodilatation and pain release of the cerebral artery, the trigeminal nerve, and its fibers. And the cell bodies of the trigeminal nerve ganglion are the main sources of CGRP. So the start of a headache part of migraine begins with the release of neurokinin substance B and CGRP, which will drain out of the brain. They go down the jugular vein to the liver where they're metabolized, and then they shortly after that will get into the toilet. The body metabolizes them. But it takes 4 to 72 hours in general for persons for these chemicals to get out of the body. And that's the reason it is said that migraine may last from 4 to 72 hours. It is not some committee meeting in the Netherlands who are at a table and drinking coffee and saying, well, we think migraine should last 4 to 72 hours or something like that. No, this time limit has reference to how the human body works, the metabolism of the body. All right, does migraine have different phases? Well, it certainly does. It has 4 individual phases. They're called prodrome, aura, the attack, and then postdrome. Well, the prodrome, it's the first phase for a migraine. It can come on hours to a day before the headache starts. And the symptoms here can be mood changes, irritability, excitability, need to urinate, food craving, yawning, depression, symptoms like that. Most people do not have an aura thing, like a visual aura, and they don't have an actual headache at that time. The aura phase, approximately 30% of persons with migraine will have an aura. 70% don't. That's called migraine with aura. The most common aura here are visual changes, seeing zigzag lines, spots, or holes in the vision, or half of things. Some people have a spreading numbness or tingling. It moves across the arm and fingers, goes to the forearm, and it'll go to the face and the jaw and the tongue. But after the tingling moves up and clears, it all goes away. And then a small number of patients may have after that aphasia, which is trouble talking or programming or understanding language. And the symptoms order here is always with migraine. The aura visual symptoms come first, and then the numbness and tingling, and then the trouble speaking, which is called aphasia. And untreated, the severity of a headache is worse on day 1. If you don't take any medicine, you're out in the woods and have a migraine come on, and the headache is worse day 1. It gets better by day 3 if you're just going to have a single attack of migraine. One survey of 1,100 migraine patients published in May of 2020 in the journal Headache reported that 44% of patients said that their migraine headache phase usually lasts up to 24 hours. 33 and a third patients had headaches lasting longer than 24 hours. Now, after the migraine, there's the postdrome phase, and at this time, most people have little or no headache. The headache's achy. If they touch the head, or if they lie on a pillow, or they're wearing glasses on them, they may have sensitivity to touch, which is called allodynia. Allodynia means touch is perceived as painful. The patients are not as sharp mentally. They feel kind of hungover. They have trouble feeling up, feel elated. Some people are hyper or euphoric. And so then after that, the symptoms go away and we're all over it. Or why did many people with migraine only have headache for a short period of time? Because a lot of people think, if you're going to use this 4 to 72 hour schema, how is it that most people with migraine fit into that? Well, in today's world, it's because they're treating it. So I've had patients who said in 10, 15, or 20 minutes, if they take their migraine treatment, the headaches are gone. If you treat quickly at the onset of a headache with a triptan, and generally we're talking about the short-acting triptans there, which are zolmitriptan nasal spray 5 milligrams, or injectable sumatriptan 6 milligrams subcutaneously. The oral triptans, they all take about 30 minutes to work to come on. You can also use nasal spray or intramuscular DHE, dihydroergotamine, or you could take a drop of timolol eye drop in the eye, which is a very quick drug, works for a lot of folks for acute onset treatment of migraine. Now, there's also an issue when during a course of a migraine should the patient treat. And I always urge patients to treat at the beginning during prodrome if they can recall it then. If they can treat it before a headache starts, get the medicine in there, they stop the whole thing. And this treats before the headache starts. So 30% of patients who have an aura, which usually starts with visual aura, the patients with that kind of migraine should treat at the start of an aura. If you start getting the zigzag lines or flashing lights, you should take your medicine then with a triptan. And 70% of patients who have migraine without aura, those folks don't have usually prodrome or aura symptoms. So they should treat at the onset of the headache. And a general acute therapy migraine with a triptan can give 2-hour headache-free experience for 70 to 80% of persons. That's why triptan's still the king of the hill, the best drug for treating migraine. Especially they work quicker, they're cheaper than the drugs for acute therapy of migraine. Now, it's now 2021 when I'm dictating this, and last year we had 3 new drugs that came out. I'm going to call them the new migraine treatment drugs 2020, and these drugs are Rebound, Nurtec, ODT, and Brevely. They're all name brand drugs. They're more expensive than triptans. And the listed product for the new drug states that Nurtec provides pain relief in 1 hour. Brevely provides freedom from headache pain at 2 hours for 20% of patients. And the advertising drug information for Rebound says it could provide fast and complete pain relief in 2 hours. David Ryan, the chief medical officer for ICER, which was a panel that reviewed the use of these drugs, said, quote, for patients who are unable to take triptans who don't get adequate benefit from those more affordable options, these new migraine therapies appear to relieve migraine symptoms in 10 to 20% more patients than who respond to placebo. So we're looking at a tiny band, narrow group of patients who respond to these drugs. The triptans work more for persons and are usually faster than the new 2020 migraine drugs. And the point of this information regarding treatment is that for all of the acute therapy drugs for migraine, the key question would be namely how to answer how long a migraine lasts. If you get triptan treatment for a migraine early on, you may be able to get rid of your headache in 30 minutes. For that person, the answer to this question of how long does a migraine last is about 30 minutes. But if you don't have a triptan or a drug that works like that, if you use an Advil or Tylenol, the headache may last several hours or maybe half a day, maybe a whole day. And then the next day they go in the post-drome and have a sore head and that kind of thing. So anyway, it's hard to tell, but when we say migraine this lasts 40 to 72 hours, we're hopefully talking about patients who are treating early with a triptan. So what happens to migraine patients who get a week or 2 a month or years of daily migraine? They usually start having longer lasting, more frequent headaches and develop chronic migraine because they're overtreating with headache drugs. This group of patients is likely making the following mistakes to prolong the duration of the headache. They're not using the triptan or one of the new 2020 drugs for treatment. They're using over-the-counter drugs like Excedrin, ibuprofen, Tylenol, naproxen, which may provide a little or a lot of headache relief, but many times they're not enough to end or stop the headache, give what we call in the headache world a headache-free experience. The problem is then they keep taking the drugs too often, then they may develop transformation of migraine from episodic migraine to chronic migraine. Another scenario is that some migrainists may use a drug that provides adequate treatment like a triptan, but they do not treat at the onset of the migraine. They treat too late, and if they use the triptan, they do not have a 2-hour headache-free experience. Their headaches continue and last longer. Now, it's been said all along that treating with a triptan any time during the course of a migraine will help it some, but it won't give you a 2-hour headache-free experience if it's not taken at the onset. In my office, talking to patients over and again, I would always ask them, when did the headache start and when did you treat it? Because those are important issues. And I would get an answer like this from a lot of folks. Well, it wasn't that bad. I didn't know it was a migraine. I was at work. I didn't want to have to take my medicine, so I took 2 Advil. Well, what time was that? Well, I took that at 9:30 in the morning. What happened next? Well, the headache started getting bad, so about 10:30, 11 o'clock. I think I actually waited till noon because I was going to leave my desk and go have something to eat. That's when I took my triptan. I see, and what happened next? Well, the headache got a little better, but I had it all day long and really the next day. The answer there, as you can see, is they first pre-treated with a drug over the counter like Advil. It's not going to work that well. It doesn't work to stop the release, block the release of these neurochemicals like triptans do. So they took the wrong type of drug, and then they finally took their triptan, 8 o'clock, 9:30, the headache starts at noon for about 2.5 hours later. All right, to talk about that, then we're going to get into to talk about what's called the migraine timing cycle. So it's generally thought that local vasodilatation of intracranial blood vessels and consequent stimulation of trigeminal nervous symptoms is a key mechanism underlying the generation of headache pain with migraine. So it's the activation of the trigeminal system that's thought to cause the problem. And if you take one of the triptans, they block the release of the neurochemicals, and that's how they work. So the migraine timing cycle spelled out is, number 1, trigeminal activation and cerebral artery vasodilatation. Let's say that happened at 9:30 in the morning, continuing the story with the patient I was talking about a while ago. Stage 2, 20 to 40 minutes later, the neurochemicals CGRP, neurokinin A, and substance P are released by the migraine process from the ganglia to inflame the trigeminal nerve, the arteries, and later the thalamus, which is the pain center of the brain. Stage 3, at 2 hours, the arteries vasodilate and they're inflamed. Blood pulsing through dilated, inflamed arteries causes pulsatile, pounding headache. Stage 4, past 3 hours, the thalamus is, we know as the pain center of the brain, is turned on in the migraine process. The headache may get worse at that time. On my website at www.migraine.com, I have a picture of this whole kind of thing there. So migraine is an episodic disorder of headache lasting 4 to 72 hours. After a migraine, within a day or so, the nerve peptides in the brain are metabolized and leave the body, and in a few days they go down to the liver and out of the body into the toilet. However, if one overtreats with certain drugs, caffeine, NSAIDs, Tylenol, pseudoephedrine, triptans, hydrocodone, butalbital, then these painkiller drugs drive this cyclic product, 1, 2, 3, 4, so the neurochemicals are released, the headache keeps going on. At that point, I usually tell patients it's like you've got a fire, you put gasoline on it. Well, the fire is going to keep going. The fire doesn't go out. So taking pain medicines continuously, day 2, 3, 4, a week, a month, a couple of months, a year, after your headache starts, is a bad thing to do. All right. At that point, episodic migraine then is transformed to chronic migraine, which is defined again as 15 headache days a month, 8 of which have migraine headaches. This occurs because the body doesn't have enough time to eliminate the drugs, the chemical, like let's say Advil or something like that, or the released peptides, and they stay in the brain, they activate the system so that 1, 2, 3, 4, the migraine cycle goes on continuously, resulting in frequent, sometimes daily headache. Now, back in 1988, we had the first international classification of headache in the world, and they called this overtreatment syndrome rebound headaches, like a basketball term. You put the ball up, and it comes back down, you get a rebound. But now that term has been replaced by the phrase medication overuse headache. And this is a common headache diagnosis and problem, which comprises about 80 to 90% of new patients to a headache practice. And the International Classification of Headache Disorder states that all migraine patients should limit painkillers, caffeine, triptans to no more than 2 days a week, because that's the most the body can tolerate, and get rid of the drug and the neurochemicals without transforming into more frequent headache. I remember years ago I went to a headache lecture in Dallas. There was a colleague of mine who was giving a talk on medication over his headache, and he approved taking 3 different days for treatment of migraine. I sat very quietly during my seat. I didn't say a word. I said, no, the limit is 2 days. So medication over headache relates intimately to how long a migraine headache lasts. Persons who overtreat all have long-lasting migraines, all durations longer than the textbook time of 4 to 72 hours. So medication overuse headache occurs mainly in migraine patients and rarely with tension-type headache. There's a common pattern of transformation from rare or episodic migraine into chronic migraine. Medication overuse headache is a concerning, disabling, well-known worldwide problem. The problem with it now is that patients routinely will rotate different drugs during that time also. And they take many drugs at the same time that causes or worsens the syndrome, the headache. So to get into that a little bit, the most common drug in America that people are taking over the counter that can aggravate or drive headache is caffeine. God bless them. Because a lot of people are drinking 2, migraine patients, 3, 4 drinks of caffeine a day. That can aggravate migraine headache and keep it going. And then on top of that, they may get a migraine, so they take up a Tylenol, maybe see their GP, he may give some tramadol, which is an opiate narcotic, should never be used for migraine, and they start taking that. So they've really got, in that story, 3 different, they got Tylenol, they got caffeine, they got tramadol in their brain that's aggravating migraine headache, and they need to get all off of all that. So what are the limits of drugs that can cause medication overuse headache? The International Classification of Headache Disorder says that for taking triptans, if you take triptans more than 10 days a month, you can get headache from that. For non-opiate analgesic drugs like caffeine, acetaminophen, ibuprofen, naproxen, if you take 15 days a month, If you take butalbital and opioid narcotics more than 10 days a month, and just a statement there, butalbital and opioid narcotics should never be taken for any kind of headache. Butalbital drugs are Fiorinol or Esjec, and they've been banned in every country in the world except Canada, the United States. And the joke at headache meetings on that is that America is the only drug persons at the Mexican border go into America to buy, because it's illegal in Mexico, but they can buy butalbital in America. So I'm moving to the bottom line here, is regarding the duration, how long does the migraine last? It's usually 4 to 72 hours, unless the migraine victim is overtreating with headache medicine. Then who knows how long the headaches may last. I once saw a woman who started taking 6 Advil a day when she was 6 years old at her mother's behest. And I saw her when she was in her 60s, when she came in for daily headaches from taking Advil. She got off of it and they backed off. So thank you very much for listening to this. Please click on subscribe down there, and I will see you at our next talk.